So in the SCOUT HCM trial, we looked at 44 adolescents that have symptomatic obstructive hypertrophic cardiomyopathy, meaning they've got hypertrophic cardiomyopathy and there was a pretty significant amount of obstruction across the left ventricular outflow tract. We measured that with Valsalva gradient, which was the primary endpoint, was a reduction in the Valsalva gradient. And the patients were randomized to either receive mavacamten, which is a new class of medication that are called myosin inhibitors, or placebo. And what we found was a pretty significant reduction in the patients that received mavacamten in this Valsalva left ventricular outflow tract obstruction. So prior to mavacamten, we didn't have any medicines that were really targeted for the underlying pathophysiology of the disease. And the medicines that we have really target symptoms, but don't generally affect the amount of obstruction that the heart sees. So we saw a pretty dramatic reduction in the gradients, and that corresponded to other improvements in terms of what we call heart failure functional class, so patients felt better. We saw improvements in some biomarkers of myocardial injury and myocardial stress, and we saw improvements in parameters of the diastolic function, so how the heart relaxes. All of this was very encouraging that we're seeing a significantly beneficial effect of this medication. So we saw pretty dramatic improvements in almost all of our secondary endpoints. So those included things like natriuretic peptide levels, which were markedly high at baseline. Those came down pretty substantially in the mavacamten treated patients and actually went up a little bit in the placebo treated patients. The same thing we saw with troponin levels, which are a marker of myocardial injury. So there's ongoing, injury to the heart in these patients that have such severe obstruction. And we saw a decrement in these troponin levels in patients with mavacamten, and actually a slight increase in patients that were receiving placebo. The same thing with some of our markers of diastolic function improved with mavacamten. The degree of mitral valve regurgitation also improved, and the New York Heart Association functional class approved in patients that were on mavacamten. So we're very excited about these results. Mavacamten is not yet approved by regulatory authorities. We're certainly hopeful that it will receive approval soon for children. It is approved for the use in adults, but we're hopeful that we will soon have approval for children. And I think it's also just important to note it's a relatively small study, and the follow-up was relatively short at 28 weeks. We do have a long-term follow-up study that's ongoing, and we should have those results soon. We're optimistic that these effects that we've seen will be sustained over time. We've seen that in adults that have been on mavacamten, that they've had sustained results some out to several years, but we need this longer-term data for children as well.